Here's analysis on another day of COVID chaos. I'm joined from Canberra by Sky News political editor Andrew Clennell. All right, Andrew, 4 capital cities tonight as we go to air are in lockdown. In the case of Brisbane, over 1 case of COVID-19 and a health worker, we're told now that's the Delta variant. You'll have heard my editorial. I mean, what is the point of National Cabinet? Surely the PM's got to put that to one side. It's achieving bugger all, and he's got to take charge and lead.
Well, it's hard to disagree with you, Peter. What I'm led to believe is that Brendan Murphy, the Health Secretary's been a big problem here, and Scott Morrison and Greg Hunt have listened to him, and it's been their folly. And what I've been told is that he opposed a plan by Gladys Berejiklian to have the vaccinations in stadiums. He's opposed the plan to have pharmacies do the vaccinations, or at least push them out. He's opposed the regional quarantine idea, and he was confident in the AstraZeneca solution. And so bit by bit, every decision he's advised, and they love talking about health advice to hide their decisions behind that, don't they, appear to be being overturned. And he's been usurped with the appointment of JJ Frewen. So that's what's going on here, insiders are telling me. And Scott Morrison, he needs to show leadership. I mean, if one more leader says to me, we always listen to the health advice, whether it's the PM, whether it's Gladys Berejiklian, whether it's Anastasia Palaszczuk, whether it's Dan Andrews or whether it's Mark McGowan, yes, you listen to the health advice, but at the end of the day, you're in charge. Winston Churchill didn't just listen to the military advice. I mean, that's an extreme example, but I think that's part of the problem here. And Scott Morrison needs to take a few risks.
I can give you plenty of
please do.
examples in my time where public servants would sit around the table and tell you why you can't do something or why you must do it in a particular way. And politicians will take in that advice, but in the end, the good ones make their own decisions. Now, I have heard similar things in relation to Brendan Murphy, but I guess it all sits, again, on the Prime Minister's head in the end, and Greg Hunt, the Health Minister, because if they give you advice and you take it and you get a suboptimal outcome, well, more fool you for taking their advice again and again and again and again. I mean, if all of those things that you rattled off just then are all failures, and yet he's still running the health department, everyone's still taking his advice, well, then you get what you pay for. I mean, I was talking to someone in New York yesterday. They've got the Yankee Stadium open. I mean, New York is back. Restaurants are open. People are in the parks. And you can't move down the street without being able to find a drugstore, a small one, big one, Yankee Stadium, supermarkets even, are all handing out the jab. You walk in, you get your choice of 3. They've got 3 different jabs over there. In Australia, you can sit on the phone for 5-6 hours in Victoria to even get an appointment to get a jab. And you're getting all of these mixed messages we saw again last night on AstraZeneca. I think it's an absolute shambles, and I think it'll kill the PM if he doesn't get out there and fix it quick smart.
I think that's right. And he was on such a high with the G7, you know, we spoke about that. Just goes to show you how this virus and the politics around it, they don't always favour the incumbent if you stuff it up, and it can bring you down with a thud. So he's got some challenges. And look, all this business of we're holding an emergency national cabinet, you know, which is what you were talking about. We're on a war footing. All this spin, just fix it. Just get jabs in arms. Do whatever you have to do. Ring up Boris Johnson, get it sorted. You know, that's what the sort of state the PM has to get into. Now, I think last night, whether the National Cabinet ticked off on it or not, was a good first step, trying to encourage young people to get AstraZeneca. Enough people in the UK have it, but there's more to be done. And he needs to start treating it as a war footing, not just have his people brief journalists that it's a war footing.
Yeah, well, we saw the polling he's taken hit. This is new news poll polling in the Australian today. 61% of Australians think he's handling it well. That's down from 70% in April and up in the high 80s last year. Now 61, still a strong number. I'm sure Anthony Albanese would love the 61%, but nonetheless, I'm all about the trend, you know, the trajectory. The trajectory is getting him into trouble. We have the vaccine rollout announced in last November. We had the commentary last night about aged care workers. Well, they don't have to meet that new test of vaccination until September, on the other side of winter. I just think it's crazy. And when you can see where we are in the world, the OECD graph, we're under 5% in terms of full vaccination. I do listen to the spin, Andrew, I'm sure you pick it up. When the government talks about vaccination rates, they always talk about the first jab, some level of cover.
Yeah,
the first jab,
totally.
and those numbers are high. But the two jabs, it's the two jabs that will give people protection, and that's the one that's causing them real... I think people have got to the point that they have absolutely had enough, and I think the PM's got a matter of days to really step up and grab this by the throat and get it sorted out.
Well, you've been in these situations as a Chief of Staff to the PM, you know, but I think, yeah, it's kind of obvious. 7% by the end of today, Greg Hunt said, in terms of 2 doses, that's just not good enough in terms of any world comparison. And, you know, they got to start doing mass vaccine hubs. The one at Homebush, Sydney Olympic Park's very good. Stadiums, pharmacists, and get the supply no matter which way you do it. I mean, it's a big world. There's got to be ways to get more supply into Australia. Now, they will say to you, we'll take 6 to 8 weeks heat on this. We're doubling the Pfizer in a couple of weeks' time. We'll be all right, but we're going to cop it for 6 to 8 weeks. But I think it requires more drastic action than this, because Australians are getting fed up. I'm getting that feedback anecdotally, and I'm sure you are as well.
And look, this stuff sits in people's memories. People will remember this sort of chaos. Forget the economic good work of Josh Frydenberg, forget the acute phase last year. This stuff is what they'll remember as they're going into the ballot box. And that could be as early as this year, probably more likely around Easter next year, not far away.
Well, I think it's the biggest fear of the government that there are outbreaks at that time. They think they're in front, and they think outbreaks and these sort of issues can cost them the election. So I think it's one of the reasons Morrison's been saying all along a 2022 election, he knew there'd be problems with supply. He knew there'd be problems with rolling out the vaccinations. But once again, I think we see a system where, in terms of service delivery, the federal government just isn't up to it. And the insistence on using GPs just hasn't helped the federal government.
No, get into the pharmacies, get those mass vaccination centres underway. Andrew Clennell, are you out of quarantine yet, or are you still locked up?
No, this is my last cross to you in quarantine, though. That's good news. But I'm going from quarantine to lockdown, so how lucky am I, Peter?
Well, you're almost a Victorian with that sort of treatment. Thank you for your time, mate.
See you, Peter.